Master USMLE Podcast, Anxiety and Trauma-Related Disorders. Welcome back to Master USMLE, where we break down high-yield Step 2 CK concepts in a way that sticks. Today, we're tackling anxiety and trauma-related disorders, some of the most commonly tested psychiatric conditions. Comparing anxiety and trauma disorders. 1. Generalized anxiety disorder, GAD. Excessive, persistent worry about multiple aspects of life, work, health, finances. Lasts greater than or equal to 6 months with symptoms like fatigue, restlessness, muscle tension, and irritability. Key distinction. Worry is generalized, not tied to a specific object or situation. 2. Panic disorder. Recurrent, unexpected panic attacks. Sudden episodes of intense fear with no clear trigger. Diagnostic criteria. After an attack, the patient has greater than or equal to 1 month of persistent worry about future attacks. Behavioral changes. Avoiding situations due to fear of another attack. Key distinction. Panic attacks occur spontaneously without an identifiable trigger. 3. Specific phobia. Intense fear of a specific object or situation, e.g., flying, heights, animals, blood. Avoidance behavior reinforces the anxiety. Key distinction. Anxiety occurs only in response to the feared stimulus and is disproportionate to the actual danger. 4. Agoraphobia. Fear of situations where escape may be difficult. Public transportation, crowded spaces, enclosed places. Often associated with panic disorder due to fear of having an attack in public. Key distinction. Avoidance involves multiple situations, not just one phobic stimulus. 5. Social anxiety disorder, AVSEAD. Fear of social interactions due to concern about embarrassment or negative evaluation. Common triggers: public speaking, eating in public, social gatherings. Key distinction. Fear is tied to social scrutiny, not a specific object or place. Trauma and stress-related disorders. 6. Acute stress disorder, ASD, versus post-traumatic stress disorder, PTSD. Both follow a traumatic event, e.g., assault, combat, accidents. Duration is the key difference. ASD, symptoms last less than or equal to 1 month. PTSD, symptoms persist greater than 1 month. Shared symptoms: intrusive memories, nightmares, flashbacks. Hypervigilance, exaggerated startle response. Avoidance of trauma-related stimuli. Negative mood and dissociation. 7. Adjustment disorder. Emotional or behavioral distress in response to a stressor, but does not meet criteria for other psychiatric disorders. Symptoms resolve within 6 months after the stressor ends. Key distinction: less severe than ASD/PTSD and directly tied to a recent identifiable stressor. USMLE high-yield takeaways panic disorder. Sudden, unexpected panic attacks, plus persistent worry, avoidance for product 1 month. Gadurs seem to excessive worry about multiple life areas for greater than or equal to 6 months. Specific phobia. Fear of a single object or situation. Avoidance. Agoraphobia. Fear of being trapped in multiple public spaces. Social anxiety disorder. Fear of embarrassment in social settings. PTSD versus ASD equals PTSD lasts greater than 1 month. ASD resolves within 1 month. Adjustment disorder. Chance. Emotional distress from a stressor, but symptoms resolve within 6 months. Recognizing the differences between these disorders is key for both the exam and clinical practice. That's it for today. Stay focused, keep practicing, and master the USMLE.